Obturator nerve. In previous videos, we explained the lumbar plexus, and in lumbar plexus, we mentioned that anterior primary MI of L2, 3, and 4 divide into dorsal divisions, which is the yellow color, and the ventral division, which is the green color. And in previous videos, we said that dorsal divisions of L2, 3, and 4 form the femoral nerve, while the ventral or anterior divisions of L2, 3, and 4 lumbar nerves form the obturator nerve. And I forget to mention the mnemonics of lumbar plexus. Let us see this mnemonics. Branches of brachial of lumbar plexus can be summarized in this mnemonic. I twice get laid on Friday. I remember ilioinguinal and iliohypogastric. Get genitofemoral. Lead lateral cutaneous nerve of the thigh. On obturator. Friday F is femoral. Let us take our subject today, which is obturator nerve. The obturator nerve begins as a branch from the lumbar plexus, from the ventral divisions of L2, 3, and 4 lumbar nerves. It ends in the medial compartment of the thigh by dividing into anterior and posterior division. And you should remember that obturator nerve is the nerve of the medial group of the thigh. What is the relations of obturator nerve? The obturator nerve emerges from the medial border. Of psoas major muscle. This is the obturator nerve here. This is the psoas major, and the obturator nerve emerges from the medial border of psoas major muscle. Then pass along the lateral wall of the pelvis, accompanied by obturator vessels. Then passing in the femoral canal to reach the medial aspect of the thigh. And when reach the medial aspect of the thigh, it ends by dividing into anterior division in front of adductor brevis and a posterior division posterior to the adductor brevis. The anterior division anterior to adductor brevis. And remember from the adductors, we said that the adductors are arranged in three layers. What are the 3 layers? Pectineus above and adductor longus below is the first layer. Adductor brevis is the second layer. And the adductor magnus, this muscle, is the third layer. Since the first division is the anterior division of obturator, anterior division passing anterior to adductor brevis. Therefore, this nerve related posteriorly to adductor brevis and anteriorly related to the first layer, which is pectineus and adductor longus. Concentrate in this picture. In this picture, we cut this muscle, which is pectineus. And we cut this muscle, which is adductor longus, to see the anterior division of obturator. And this muscle is the second layer, which is adductor brevis. Therefore, the anterior division of obturator passing between the first layer of adductor, which is pectineus, and the adductor longus, which are cut here, and posteriorly it is related to adductor brevis. The posterior division piercing this muscle. In the dissected bodies, we will never see this muscle except after division of pectineus. This muscle, which lying deep to the pectineus, is called obturator externus muscle. The posterior division of obturator pierces the obturator externus muscle. Pierce the obturator externus muscle and passing posterior to the adductor brevis. Therefore, the posterior division lying between the second layer and the third layer. Anterior to the posterior division, there is adductor brevis. And the posterior to the posterior division, there is adductor magnus. What are the branches of obturator nerve? Before we take the branches, you should always remember that obturator nerve is the nerve supply of the medial aspect of the thigh. It is the nerve of the medial group of the muscles of the thigh and the nerve of the medial aspect of the thigh. Collectively, as a muscular branches, you can write, as we take in the muscle, obturator nerve supplying all muscles of the medial group except the pectineus, which is very close to femoral and supplied mainly by femoral. And sometimes additional nerve supply from obturator may reach the pectineus. But this is occasion. And obturator nerve supplying all medial group except pectineus and ischial part of adductor magnus, which is supplied by sciatic nerve. For more details, what are the branches of the anterior division? The branches of the anterior division, muscular, it supplies the adductor longus, supplying the adductor longus and the adductor brevis and supplying this muscle. What is this muscle? Gracilis. Therefore, the anterior group, the anterior division of obturator supplying adductor longus, adductor brevis and gracilis. And sometimes they may send additional branch to pectineus. Anterior division gives the articular branches to the nearby joint, which is a hip joint. Cutaneous branches, obturator nerve, supplying a very small area on the medial aspect of the skin of the thigh, below the area supplied by ilioinguinal nerve. Therefore, the medial aspect of the thigh is supplied by three nerves. The area in contact with the genitalia, supplied by ilioinguinal nerve. Small area below ilioinguinal nerve for the cutaneous branch of anterior division of obturator, and the remaining area for the medial cutaneous nerve of the thigh, which is a branch of femoral. The posterior division gives what branches? The posterior division piercing the obturator externus, and any nerve piercing a muscle should supply this muscle. Therefore, the first muscle is obturator externus. Then it supply adductor brevis. Therefore, adductor brevis take branches from the anterior division and the posterior divisions of obturator. And finally, the posterior division near the posterior layer of the adductors supplies the pubic part of adductor magnus muscle. The posterior division of obturator gives the articular branch to the knee joint. Therefore, the anterior division gives the articular branch to the hip, while the posterior division gives the articular branch to the knee. What is the effect of obturator nerve injury? Sure, injury of obturator nerve leading to motor effect, paralysis of the adductors, or most of the adductors. Paralysis of most of the adductors leading to loss or very weak adduction of the thigh. Loss of adduction or weak adduction of the thigh due to paralysis of the adductor muscles. Sensor loss, loss of sensation over a very small limited area over the medial aspect of the thigh. This is the obturator nerve. Thank you for good listening and good luck.